Well, maternal nutrition is important along the whole pregnancy journey, even from preconception to after birth. It is needed to support the good health of mothers and also the good health of babies. Specifically, during preconception, pregnancy, and breastfeeding periods, there are increased needs for specific micronutrients such as folate, iodine, iron, calcium, zinc, DHA, etc. Recommendations for optimum nutrition are widespread. Many studies have shown that women of childbearing age present with deficiencies in these key micronutrients, and these deficiencies have a significant health impact on both the mothers and the babies. For example, for the mothers, there's a higher risk of anemia, preeclampsia, and for the babies, there's a higher risk of preterm birth, low birth weight, and neurodevelopmental delays. Healthy maternal dietary pattern, along with adequate maternal body composition, metabolism, and placental nutrient supply, reduces the risk of maternal, fetal, and long-term effects in the offspring. Multiple micronutrient supplement is an antenatal supplement that provides the right amounts of vitamins and minerals for pregnant women, and they have been proven to enhance maternal nutrition status. And in comparison with iron and folic acid supplementation alone, it further reduces the risk of adverse birth outcomes such as preterm birth, low birth weight, and small for gestational age. While undernutrition is mainly an issue of low-resource countries, malnutrition due to poor quality diet is becoming a global health problem. Preconception counseling of women of childbearing age should increase awareness of the importance of maternal optimum nutrition before and during pregnancy, and should promote a lifestyle change in favor of a healthy weight before conceiving and balanced healthy diet. In industrialized countries, although a balanced diet is generally accessible, a switch to a high-fat and low-quality diet has led to inadequate vitamin and mineral intake during pregnancy. Evidence do not support a routine multiple micronutrient supplementation, but highlights the importance of an individualized approach in order to recognize nutritional deficiencies of individuals, leading to healthy dietary practices prior to conception and eventually to tailored supplementation. Folate is vitamin B9. It is important in red blood cell formation and for healthy cell growth and function. Folic acid is the synthetic form of folate used in supplements and in fortified foods such as rice, pasta, bread, and some breakfast cereals. The nutrient is crucial during early pregnancy to reduce the risk of birth defects of the brain and spine. Folate is found mainly in dark green leafy vegetables, beans, peas, and nuts. All women of reproductive age are advised to take 400 micrograms of folic acid each day, in addition to consuming food with folate from a varied diet to help prevent neurotube defects. 5-methyl tetrahydrofolate, or methylfolate in short, is a biologically active form of folate and is the predominant active metabolite after intake of folic acid. Being a natural form of folate, methylfolate has many advantages over synthetic folic acid. For example, methylfolate is well absorbed and its bioavailability is not affected by metabolic defects. Methylfolate also has no tolerable upper intake level and will not mask vitamin B12 deficiency. DHA is an omega-3 fatty acid that is found in cold water fish, including salmon and sea bass. DHA plays a key role in the development of the brain, eye, and nervous system. High-dose DHA influences immune responses during pregnancy and may reduce the risk of preterm birth. To optimize pregnancy outcomes and fetal health, consensus guidelines have recommended that pregnant women consume at least 200 milligrams of DHA per day. A recent study comparing a daily 1,000 milligram dose of DHA versus 200 milligrams showed a lower early preterm birth rate, especially if participants had a low DHA status at enrollment. The high dose was associated with fewer serious adverse events. For the mother, lower rate of premature rupture membranes and pyelonephritis, and for the baby, there were fewer feeding, genital urinary, and neurologic problems. So the conclusion was that clinicians could consider prescribing 1,000 milligrams DHA daily during pregnancy to reduce early preterm birth in women with low DHA status if they are able to screen for DHA. Lactating women need an increase in calories and nutrients in order to maintain their nutrient and energy stores, while allowing for the gradual loss of weight gained during pregnancy. And of course, lactation raises nutrient needs, mainly because of the loss of nutrients, first through colostrum and then through breast milk. Milk content for some vitamins and minerals, such as vitamin A, thiamine, riboflavin, vitamin B6, and iodine, is affected by the lactating women's nutrition. Consumption of a healthy, well-balanced diet that includes dairy, meat, and fish and other vitamin and mineral-rich food is important. But on the other hand, taking supplements is one way of ensuring good milk quality, especially for those who do not get enough of these vitamins and minerals through diet alone. Healthcare providers should work with lactating women to determine if they need supplementation to achieve adequate intake. As healthcare providers, it is important to keep up to date on nutrition knowledge and nutritional needs of mothers-to-be, pregnant and lactating women. Maternal nutrition is recognized as a high priority global health issue that requires urgent attention as it is integral to a variety of weight, nutrition, and health-related sustainable development goals. Improving maternal nutrition is fundamental to improving child health outcomes, protecting women's health in the postpartum period, and potentially interrupting the intergenerational passage of poor health risk. International organizations such as FIGO, the International Federation of Gynecology and Obstetrics, recommend that all women receive nutrition and weight counseling during pregnancy, which can improve maternal nutrition knowledge, dietary intakes, and clinical outcomes like anemia, birth weight with reduced risk of perinatal complications. FIGO has developed a nutrition checklist, which is a tool designed to address these issues. The checklist contains questions on specific dietary requirements, body mass index, diet quality, and micronutrients. And through answering these questions, awareness is generated, potential risks are identified, and information is collected that can form health-promoting conversations between women and their healthcare providers. We should inform our patients about optimum nutrition, including possible supplementation before, during, and after pregnancy, irrespective of whether the woman is breastfeeding or not.